respira profundo así. I came here straight from residency. I knew I wanted to work in a community health clinic.
Pediatrician Korina Deleon has always wanted to help underprivileged children. She's been able to live her dream here at the CentroMed Community Health Center in San Antonio. However, she almost wasn't able to practice the type of medicine she wanted because of her huge debt from medical school.
The loans to go to school, whether it's college or medical school, is astronomical. It's a big amount of money that we incur while we're doing school.
In fact, the average medical school debt is $130,000 per student. That's why fewer and fewer medical students are going into primary care. Only 2%, according to a recent survey by the Journal of the American Medical Association.
There's a big concern on how long it's going to take to repay those loans if you go to a job that does not pay as competitively as other specialties do.
It's one of the main reasons why a shortage of family care providers in Texas is escalating out of control, particularly in rural and inner-city areas. Dozens of counties don't have any primary care doctors or dentists, and a growing number of communities in Texas are dangerously underserved. That's driving more and more families to overcrowded, expensive emergency rooms for care, or worse yet, going without care. Dr. Deleon was able to come here to San Antonio because she benefited from one of the limited number of medical school loan repayment programs that are available today.
So the loan repayment program is a wonderful incentive to bring good, qualified doctors to do this kind of work.
Loan repayment programs work to bring providers like Korina Deleon to areas of the state where they are desperately needed. That's one of the provisions of a bill introduced in the Texas Legislature to address the family care provider shortage. House Bill 1876 would create the Texas Healthcare Access Fund. It would consolidate the limited loan repayment programs under one umbrella and significantly expand them and increase funding, so that physicians and other healthcare providers agreeing to practice in underserved communities could receive up to $160,000 in loan repayments over 4 years of service. House Bill 1876 would also bring more funding to bring additional resources to community health centers like CentroMed to give more Texans a medical home.
I come here because I live in the neighborhood and I have low income, and this is a clinic where I can come and receive good services.
I think with our current economy, there's a big problem with healthcare issue, and we're going to see a big increase in numbers as far as patients coming to clinics such as ours who help those without insurance or who are underinsured. And as a result of that, we're going to need more doctors. I think the loan repayment program is a great and wonderful incentive to get good physicians to come to these kind of clinics to help with the increased number of patients that we're going to be seeing in the future.